Tuberculosis, TBI. Understanding the pathophysiology of tuberculosis, TB. 1. Key concept: an infectious disease caused by Mycobacterium tuberculosis, MTB, primarily affecting the lungs but can also involve other organs. 2. Simplified explanation: think of TB as a sneaky bacteria that infects the lungs and can spread to other parts of the body. 2. It's a persistent infection difficult to eradicate. 3. Mnemonic, MAX. For key aspects of TB, Mycobacterium tuberculosis, bacterium. Airborne transmission. Causes formation, granulomas. Slow-growing and persistent infection. 4. Key features: Mycobacterium tuberculosis, MTB, an acid-fast bacterium that multiplies slowly. Airborne transmission. Spread through airborne droplets produced when an infected person coughs, sneezes, speaks, or sings. Infection process. MTB enters the lungs, is engulfed by macrophages, and forms granulomas, tubercles, collections of immune cells trying to contain the infection. Latent TB infection, LTBI. The bacteria are contained within granulomas but are not active or causing symptoms. Can become active at a later time. Active TB disease. Bacteria become active, multiply, and cause tissue damage, inflammation, and symptoms. 5. Types of TB. Pulmonary TB. Affects the lungs, most common. Extrapulmonary TB. Affects organs outside the lungs, such as lymph nodes, pleura, bones, kidneys, meninges, and other locations. Miliary TB. Disseminated TB, with widespread involvement of many organs. 2. Clinical manifestations of tuberculosis, TB. 1. Key idea: symptoms vary based on whether the infection is latent or active, and on the location of disease involvement. 2. Mnemonic for active TB symptoms: fat cold, fatigue and malaise, anorexia or loss of appetite and weight loss, temperature with fever or chills, cough, persistent and can progress to be productive, often night sweats. Lymphadenopathy can occur in extrapulmonary TB, dyspnea, shortness of breath, in active pulmonary TB. 3. Specific symptoms: pulmonary TB, persistent cough, often productive, chest pain, hemoptysis, coughing up blood, weight loss, fever, night sweats, and fatigue. Extrapulmonary TB. Symptoms depend on the affected organs such as lymphadenopathy, bone pain, headache, and neurological deficits. Latent TB infection, LTBI, no symptoms as the bacteria are dormant. 4. Important note: immunocompromised individuals, for example HIV, are at a higher risk for developing active TB and severe disease. 3. Diagnosis of tuberculosis, TB. 1 key idea: diagnosis involves a combination of skin tests, blood tests, imaging, and sputum analysis. 2. Mnemonic for diagnosis: spit. Skin testing: MAN2 test, TST. Intradermal injection of tuberculin. A positive result indicates exposure to TB, but not necessarily active disease. Physical assessment, auscultation, and medical history. Interferon gamma release assays, IGRAs. Blood tests, for example, quantiferon, T-spot, that measure the immune response to TB. Useful for LTBI diagnosis. Testing of sputum and other body fluids. Sputum smear microscopy, rapid but not very sensitive. Acid-fast bacilli, AFB, are observed if present. Sputum culture, gold standard for TB diagnosis. Identifies the organism and allows for drug susceptibility testing. Nucleic acid amplification testing, NAAT, PCR. Tests on respiratory samples to rapidly detect TB DNA or RNA. 3. Additional tests. Chest X-ray can show lung infiltrates, cavities, or lymphadenopathy. CT scan may be needed for a more detailed look at lung tissue and assess for extrapulmonary involvement. IV. Management of tuberculosis, TB. Pharmacology focus. 1. Key idea: treatment involves a multi-drug regimen for several months to eradicate the bacteria and prevent drug resistance. 2. A mnemonic for initial treatment: RIPE, for the first 2 months. Rifampin, isoniazid, pyrazinamide, ethambutol. All 4 are given for the initial 2-month phase, and then rifampin and isoniazid are continued for an additional 4-7 months, depending on the case. 3. Drugs in detail. Rifampin. Mechanism of action: inhibits bacterial RNA synthesis by binding to RNA polymerase. Key side effects: red-orange discoloration of body fluids, tears, urine, sweat, hepatotoxicity, and drug interactions. Induces CYP450 enzymes, which can alter the metabolism of other drugs. Memory tip: rifampin =, reddish fluids. Isoniazid, INH. Mechanism of action: inhibits synthesis of mycolic acids, a key component of the mycobacterial cell wall. Key side effects: peripheral neuropathy, preventable with pyridoxine, vitamin B6, hepatotoxicity. Memory tip: isoniazid =, INH, injures nerves, hepatotoxicity. Remember to give pyridoxine to prevent neuropathy. Pyrazinamide, PZA. Mechanism of action: unknown mechanism, appears to disrupt mycobacterial cell membrane synthesis and transport. Key side effects: hepatotoxicity, hyperuricemia, gout, arthralgias, joint pain. Memory tip: pyrazinamide =, PZA painful joints, zaps the liver. Ethambutol, EMB. Mechanism of action: inhibits arabinosyl transferases, which are involved in the synthesis of the mycobacterial cell wall. Key side effects: optic neuritis, decreased visual acuity, color blindness, must have regular eye exams. Memory tip: ethambutol =, EMB eyes may be affected. 4. Continuation phase drugs, usually just rifampin and isoniazid, given for another 4-7 months depending on the type of TB and response to therapy. Mnemonic: RI =, rifampin and isoniazid. 5. Latent TB infection, LTBI. Treatment: isoniazid INH monotherapy, given for 6-9 months. Rifampin can be used as a monotherapy for 4 months. Isoniazid and rifapentine, given for 3 months once weekly. Other drugs: streptomycin, aminoglycoside antibiotic, used when resistance to first-line drugs is suspected. Ethionamide, cycloserine, aminosalicylic acid, used when second-line drugs are needed. Fluoroquinolones, for example moxifloxacin, levofloxacin, can be used in certain cases, for example drug-resistant strains. Bedaquiline, pretomanid, delamanid, new anti-TB drugs used for multi-drug resistance. 6. Drug resistance, multi-drug-resistant TB, MDR-TB, resistant to at least rifampin and isoniazid. Extensively drug-resistant TB, XDR-TB, resistant to rifampin, isoniazid, and a fluoroquinolone, and at least one injectable second-line agent. Treatment for drug-resistant TB requires longer, more complex treatment regimens with second-line drugs, which are often less effective and more toxic. 7. Important notes: directly observed therapy, DOT. Ensuring patient adherence to treatment by directly observing them take their medications is a key strategy for TB control. Regular monitoring, liver function tests, visual acuity, and other parameters should be monitored during treatment. Long-term treatment. Treatment lasts 6-9 months for active TB and longer for MDR or XDR TB. V. Prevention of tuberculosis, TB. One key idea: preventing transmission is critical to controlling TB. 2. Key strategies: vaccination, Bacillus calmette-guerin, BCG. Vaccine, used in some countries to prevent severe forms of TB in children, but not very effective in adults. Early diagnosis and treatment, key for preventing transmission. Public health measures, such as contact tracing, airborne isolation, and TB screenings. LTBI treatment, preventing progression to active disease. Simplified explanation. 1. Sneaky bacteria. Mycobacterium tuberculosis enters the lungs. 2. Immune response. The body tries to contain the bacteria using granulomas, tubercles. 3. Latent versus active. Infection can be dormant, LTBI, or active, causing symptoms. 4. Treatment goals. Kill the bacteria, prevent drug resistance, and achieve a cure. 5. Multi-drug therapy. Several drugs used together for several months are often required. 6. Drug resistance. Drug resistance is a major concern. Professor Hammer's advice for learning TB. 1. Understand MTB. Know the characteristics of Mycobacterium tuberculosis. 2. Think airborne. Transmission is through the air. 3. Know the stages. Latent versus active disease are key concepts. 4. Memorize RIPE. Know these key medications for the initial treatment phase and that they are to be given for 2 months. 5. Understand pharmacology. Mechanism of action, adverse effects and interactions of medications used for TB. 6. Focus on prevention. Public health efforts, vaccination and treatment of latent TB are key to prevention of the spread. In summary, tuberculosis, TB, is an infectious disease caused by Mycobacterium tuberculosis. It can be latent or active and can affect many organs. Treatment includes a multi-drug therapy to control the spread of the infection and to prevent drug resistance. Understanding the pathophysiology, the clinical signs and symptoms, and appropriate management of TB are critical to overall health.